For many people, their pets are family, so when they're sick, you want to give them the best care. Tonight, a KCTV5 investigation into one drug called Librela, which promises to ease pain from canine osteoarthritis.
According to the drug maker, Zoetis, it's been used to treat more than 1 million dogs in the United States. Now, KCTV5's Sharon Chen shows us why some pet owners are sounding the alarm while vets continue to prescribe it.
Go, 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 go.
You might call it controlled chaos.
Baby trying to get his feet.
And Rich Pearson relishes it. Man's best friend.
Millie!
Rich has 4 of them,
There you go.
but he used to have 5.
Rigby was a border collie. He was a golden kind of border collie.
A rescue pup Rich and wife adopted in 2018 and instantly fell in love.
And he fit in immediately. He was just so happy at all times just to be around people.
But then in November, at 6 years old, Rigby began to struggle with hip dysplasia.
Our vet had told us about a new drug, which has been branded and still's branded almost as this wonder drug called Librela. We thought, okay, this could be an opportunity for him to live the last, 6 plus, 10 plus years of his life.
Developed by Zoetis, Librela was launched in the U.S. in 2023. Given once a month, the drug works to block nerve growth, helping to control pain and improve mobility. So after researching and reviewing drug trial reports, Rigby began his first dose.
It was over the span of a few days, he started to get a rash and he didn't have a great appetite.
The vet told Rich to give the drug a full month, but as days went on, Rigby further deteriorated.
He had stopped eating completely, stopped drinking water.
Rich says Rigby was suffering and slowly dying.
We had to put him down at 1 o'clock in the morning.
Rich lost his companion of 6 years in the span of just 10 days. 3 months after Rigby died, this warning from the FDA about adverse events reported in dogs treated with Librela. KCTV5 found that according to the FDA, as of April of 2024, more than 3,000 dogs experienced reports of, quote, adverse reactions. Of those, 12% died.
There are clear concerns about this particular medication. Are those concerns legitimate?
My suspicion is that the concerns are probably founded and that the FDA issued its letter based upon enough reports. I suspect that the manufacturer might point out that, hey, there have been tens of millions of doses prescribed for dogs in the United States and Europe over the last few years. If these complications were very frequent and severe, we would have recognized or heard of more of them sooner.
Dr. Sam Franklin says before using Librela, you should ask these 3 questions. What is the specific diagnosis? What other treatments have been tried? Did they work or not work?
Work to get a diagnosis, fully understand what it is that is ailing your dog and what your numerous options are for managing that.
But if that option is Librela,
Is it safe?
I can't say yes, it's safe, but that's true of just about everything. There is risk with absolutely everything.
Come on, guys, come on, go get it.
Rich is convinced that risk took Rigby away.
We don't have kids. This is our family. This is what we've built on.
If you were to do it again, would you have taken that step with Rigby?
The answer is a resounding no. I would have traded that decision to just have him here and be with us. And be present, be sitting at my feet, but he's not.
We should mention that we did hear from people who had success with Librela, but no one wanted to talk. As for Rich, Zoetis offered him compensation, but that would mean signing a non-disclosure agreement. He told me that he declined to sign it so he could tell his story. Rich is now part of a class action lawsuit against the drug maker. Sharon Chen, KCTV5 News.